To quote Tolstoy, all complete data is complete in the same way, but all incomplete data is incomplete in its own way.
Can we mine what's already being collected from the data exhausts, from claims, EMRs, and combine those things to actually start to make predictions about outcomes for patients?
Physicians really should be knowledge workers in the 21st century, and I think that data should be entered by the appropriate mechanism, and sometimes that's a machine, and sometimes that's the patient. So let's get the people who are most connected to the data to put that data into the system and fundamentally change the paradigm of who does what in healthcare. We like to think about it as this data aggregation period, and we've done a lot of work and have done some innovative projects. We worked with Google Health and with Health Vault and have been aggregating data from many sources. So we have payer data today. We have the data that's generated from our EMR. We have the financial data that we send out and the financial data that we get back from payers. And we've been aggregating for a while now. The second phase for me for analytics then is really around transparency. So taking all of that data and making it available in a structured form that allows a physician to understand how they are doing. And so we've been doing that model. We employ all of our physicians, and they all have one-year contracts. And as part of that contract annual performance review, we review their clinical performance on an outcomes basis. So that's now been well established. Every physician gets to see their own score, and they get to see how they're performing against their colleagues over time. So we're pretty well set in that phase. Now we're moving on to what I call operational analytics. So operational analytics, by definition, requires big data infrastructure. So the goal is to take all of that data and to use it to drive the management of variation and to appropriately minimize the variation in care as we go forward. When you think about managing costs in healthcare, most of the cost improvement that we're going to see over time will come with the management of that variation from physician to physician. In order to do that, though, you must deliver actionable information at the point of care in real time in order to change behavior going forward. So we are doing a lot of that work, and I'd say that's the sweet spot of where we are. And then we're looking ahead to real predictive analytics, and so we do the basics right now. So for example, I came here from Cleveland today, and it snowed. If I had known that 2 weeks ago, we would have downsized the ORs for today because we get lots of cancellations based on that kind of information. And so again, if you're trying to manage cost, using an OR and not wasting an OR day is probably the most expensive thing that you can do in the hospital setting.
Different groups are capturing the data at different stages. So for example, what CVS is capturing versus what the payers is collecting versus what the hospital has versus what the patient has. Is there an opportunity for some sort of aggregation of all that? Is there an opportunity for bringing that together in a way that makes sense? I mean, you don't always know which data sets go best together. You have to bring it together and experiment it. But everybody has, nobody has the whole set. I mean, an example also is that sometimes you might have a lot of patient data, a lot of different patients, but you don't have it over longitudinality, or you might have a lot of longitudinality, but not a lot of patient data. So how do you, to quote Tolstoy, all complete data is complete in the same way, but all incomplete data is incomplete in its own way. And those holes, how do you patch up those holes, versus real world data or versus clinical trial data that are designed for different things?
Big data is important, but it's not just about the data. The great thing is we're living in a time now where we can start to map out what's happening in the human body on multiple levels, starting from the micro, which is our genetic, omic, to more macro measurements, what's coming from imaging, mobile health, and our interactions with the health system. So it's going to be about the analytics and our ability to crunch those numbers so that we can make predictions, not only predict what your disease trajectory is going to be. Are you likely to get disease? And when you do get disease, what your diagnosis is. But how to actually intervene, how to actually change that system so that we can improve care, and also even understand the implications that that has on a cost perspective.